Listen, over the past 5 weeks, I have shared 5 cases with you, real life cases, my own very own cases. And this week we are going to wrap it up. We started with a cracked tooth that was causing all kinds of emotional dysregulation. We talked about a 28-year-old that had panic attacks. We talked about a restless leg case. We talked about an H. pylori infection that could not get treated, was not successfully treated by anyone, and a young man whose body just rejected all kinds of things because of trauma. Some of these cases I got right. Some of them I got really wrong before I figured out right. And some of them I wasn't able to complete. We're going to wrap it all up today. I'm going to step back. I'm going to tell you what they taught me, what I learned, and how I'm going to be doing things differently in the future. So let's close out this series right now. Here we go. Welcome to the Clinical Entrepreneur Podcast. I'm Rhonda, your no fluff, tell it like it is business bestie for wellness practitioners just like you who want to build a practice you love and make a bigger impact and a little money while you're at it. So if you're ready to ditch the overwhelm, attract your dream, ideal patients, and finally run your practice with complete confidence, you're in the right place. Each week, we're tackling things from programs to patient retention to marketing strategies that actually work, sprinkled, of course, with a little sass, a lot of heart, and the step-by-step strategies that will help you get there. So grab your cup of coffee, your notebook, or whatever keeps you going, and let's build a practice you love and a life you love together. Well, hello, and have I got some updates for you today. So we have covered, as I mentioned, we've covered all of these clinical cases over the last 5 weeks, and I'm going to wrap them up for you. So I want to give you just a little bit of an update on each one of them, what I know now since the time that I've recorded them, because, some weeks have gone by, and I want to give you just an update on all of them. So let's start with a cracked tooth case. That's actually someone that I know, and she's doing so much better since starting the biofilm protocol and the stealth pathogen protocol. So she's doing so much better. I'm absolutely thrilled with her progress. So that's great. And it was funny that on that case was so weird because literally it was at the very end of our consultation call. And that was when she said, this other random thing kind of happened and I went to the dentist. Sometimes it just happened to me yesterday. Again, the same thing. Maybe I'll tell you that in a little bit. It's like the very last, you're like out of time. And then boom, in comes the thing that jumped right out of the bushes and bit you. You think, oh my gosh, what did you just say? It was like that. So once it was like ding, 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 ding. And I knew right away that was exactly what the problem was. So yes, we've got that infection. It's healing, getting better. I'm super excited about that. Second case was the panic attack, and her doctor had put her on thyroid, gave her Cipro for food poisoning, compromised digestion, all the things. Brain is just interpreting as danger, danger, danger. Well, here's the update on this one. So I just spoke with her not long ago, and the anxiety is so high. It's funny to me how do I want to say this? You know how I think sometimes people need to be sick. It's like becomes their identity. And this young woman is in a brand new relationship, just got married. And I think there's something going on there. There's something going on there. I can see it in the interpersonal way that her and her husband, I'm trying to be careful here. Can you tell? The way that they interact with each other, I can just see it. Something is not right. And they've just been married for like 5 months, 4, 5, 6 months, something like that. So the funny thing is that she was consistent about taking the supplements for her stomach. So she was consistent about that for her digestion. And I know that I can't go anywhere except deal with this upper digestion. But I also know I have to give her something to calm her down, right? So I need to give her, I put her on a couple of Gaia products, and I'm happy with those. I'm really happy with those. But what I noticed is she said to me, well, I'm not always really good about taking those. And I'm thinking, what? If we aren't taking the foot off the gas of the anxiety, then how in the world am I ever going to get that, upper digestion to function, right? She's going to stay in a sympathetic state, thereby leaving that stress response high, cortisol is high, and her gastric secretions are going to decrease. So I said, well, those are kind of important. And I would say, those would be really important for you to take. She goes, well, and then she drops it at the end of our call, of course. She said, well, I've been to 3 additional doctor's appointments and they're doing a whole bunch of tests on me, and they're doing like an endoscopy, and they're going to do, I don't know if they were going to do a colonoscopy and a few other like diagnostic-y kinds of tests. And I said, okay, well, I said, well, how does that feel for you? She said, well, my anxiety is just so high that I just need to get these done. And I said, no problem. No problem at all. It's absolutely fine. I am good with that. You do whatever makes you happy. And so she's gone down this road. She's had all this diagnostic testing. And of course, you know what they're going to say. Everything is fine. You have a little bit of gastritis, of course, and everything's fine. Everything's fine. So then they recommended her 2 supplements. One, of course, was an anxiety medication. And then another one was, I think it was a new version of a PPI, a newer one. And she said, well, what do you think if I take these? So now between us here, this is when I can sort of see the signs of self-sabotage happening. And I said to her, because if I tell her she's so anxious that she's now running down this and I'm all for like medical testing. I don't have a problem with that. But she's selectively choosing what to take and not take, and her back pain and this, that. And I said, I think you should try them. I did. Because if I tell her, no, that's not the answer, where is her belief centered right now? Her belief is 100% centered in the information that her medical doctor or medical team is going to give her. So I can't tell her not to take what her doctor is recommending. That's the most important thing. But B, at this point, even if I could, I don't think I would, because she has such a belief in them over me. It's like she wants to do it the natural way. She wants to work with me, but the anxiety is so high. She won't take her anxiety part of the protocol. And now she's marching down the medical thing. So I have yet to see what's going to happen here. But her gut is causing a problem, and that's resulting in anxiety, and she's just anxious already, overthinking it. So this case still to be determined. But right now, she's going to go on those medications. She then instantly messaged me back, and she said, well, but didn't you say that some of the medications would not be good and they would actually make it worse? And I want to bang my head against a wall and go, if you could really, really hear what you're saying, I don't want to take your stuff for anxiety, but I want to go to the doctor and I want to take the stuff, but then you tell me not to take it. And then I'm back over here saying, well, shouldn't I be taking your stuff? I can't even. So we're going to find out what happens about the panic attack girl. Restless leg, not making as much progress as I was hoping. She did have one night where she had no pain. She literally slept all night long, but she's back to I don't think there's any change. I don't think this is working. This has been 20 some years and I'm not willing to give up. I'm just not willing to give up. So I've got to go dig a little deeper. I'm going to move her into phase 2 right now. I'm just trying to calm her. She's taking bone broth at night. We're doing some glycine. We're doing all the things, and she's cutting down alcohol, which there wasn't much of it. I'm not giving up. I'm just not giving up, because restless leg is it's not normal. It's not normal physiology, and I'm not willing to give up. So I told her, you will quit before I will ever quit. I'm not going to give up on you. So I'm going to schedule another call with her. I just heard from her in the last couple of days. So that one's not progressing as fast as I would hope. The H. pylori one, yes, we're continuing to make really good progress. And I told you about the GI Adsorb. Remember the product that created the dark thoughts, the ruminating kinds of thoughts? The good thing about that is that she had the aha moment between the connection between the gut and the brain, that vagus nerve, the enteric nervous system. She was able to kind of make that connection. And so now she said, well, if that anxiety kind of came from my gut, because that's where the supplement was, right? It was going in and it was doing something. I still don't know why. I haven't found anybody that can help me with that, but it happened. And sometimes there's just odd random things that happen with supplements. Doesn't mean you throw the baby out with the bathwater, like I said. But she's like, well, how do I get my gut fixed? This was good. So yeah, we're going to now keep working on. She didn't believe there was a problem because she poops every day. She doesn't have bloating and all that. I said, you can be asymptomatic externally, but that doesn't mean that everything's good on the inside. So that's good. So that's a good outcome. I'm still kind of working on that, but her burping is continuing to get less and less and less. She's not clearing out the room like she used to. And so that's great. And then the guy that I talked about last week that I was just so bummed about. So I told you that I really care about his family, and I was able to get on a call with one of his family members. And I just said, I need to get this out in the open. I care about you, love you so much, and I'm so sorry. And what she told me was again, kind of snuck up and grabbed me out of the bushes. And she said, well, did he tell you about a brain surgery that he had when he was 3 months old? And I said, no, he did not tell me that. I did not know that. She said, yeah, sometimes he conveniently leaves stuff out that he just doesn't want you to know. And I said, well, had I known that, I would have done something totally different. So that one is just going to have to be a chapter in the book that I'm going to have to close. And if he decides he comes back, I'm going to, ask him a little bit more because I kind of not supposed to know. I mean, she told me that in confidence. So I'll have to do a little bit more pushing, maybe a little bit more investigating, a little bit more digging. But for now, the last guy that made me so sad, I'm just going to have to kind of close the book and wait until he's ready, if he ever is, to come back and work with me again. But thankfully, everything was fine. Like there was no problem with the family. Like they understood. She said, don't you even think one more thing about it. So what's so interesting is that like 5 different patients, 5 completely different puzzles, so to speak, right? Different presentations, I'll say. And when I stepped back and I kind of looked at them, this is what, and it's to some degree what I've put in the free resource called the 6 Principles, which I'll link to in the show notes. I'll give it to you shortly. But more and more I'm finding that, number one is that what I often think the first time is not right. I think, oh, well, that's your gut, or oh, that's your upper digestion, or that's your emotions, or that just had a patient yesterday, a little 10-year-old girl that will throw up for a month at a time. And I'm like, well, of course, it's her stomach. Well, then I'm talking to mom, and mom was late getting her paperwork to me, but I felt really bad because she'd waited several months for this appointment. And I said, okay, I'll just go ahead. And I'm kind of glancing at the paperwork as I'm doing the call. Don't recommend that. Not a good idea. But I did it because it just felt bad. And as we're going, I'm thinking, okay, it's this. And then mom drops another little nugget. I think, okay, wait a minute. Fork in the road. Now I have to go think about this. And then I get down that road and then mom drops another little nugget and I go, back to where I was in the beginning. And I'm like zigzagging, getting whiplash with this case all over the place. And again, it just kind of reaffirms to me that sometimes we go in, we read their information, their paperwork, and we think, okay, this is how I'm going to do it. But having the patient talk to you, I think this is the big takeaway. You have to allow them time to tell you their story because they will answer the questions on your paperwork. That's rote work, right? Check the box, answer the question. But if you can get them to use their mouth, their words, their brain, and they can actually talk about what's happening, why is this happening? This is what happened. Then I went here. And then it allows you to ask those probing questions. You will get the golden nuggets. You will. So you have to allow them to tell their story because otherwise for me, I can speak for me. Often I'm wrong the first time. Oh, not always, but I can be. So if I get them to tell the story, then I get the secrets. And that is my second principle. And the secrets come at last. I don't know why. Is the brain just withholding this information? Is there some, punk? We're punking Rhonda? I don't know. I don't get it. But it's always like at the last of the conversation. So I'm going to tell you here about what happened yesterday. I won't go into detail because we don't have time, but I had a case, this little 10-year-old girl, and the mom is telling me about the throwing up and all the things. And I'm going through her, kind of reading her paperwork and listening. Again, not advisable. And we get all the way through. We went over on our time a little bit because there were so many little twists and turns. And when she was 5, she lost her grandmother, 4, she lost her grandmother, who she was very close to. 2 months later, her best friend dog died. Dog slept with her every night. They were inseparable. So 2 months later, the dog died. And within the next year, her parents got a divorce. So in my mind, this came about halfway through the conversation. In my mind, I'm thinking, oh my gosh, we got an emotional thing about loss and illness, and there's got to be some emotional stuff there. No one would disagree with that, right? For this little girl who's 10 now. But I kept saying to the mom, like, has she always thrown up? Well, no, but she always had kind of a sensitive stomach. Okay, well, when did the more than just a sensitive stomach start? And she said, well, this is before I knew about all the loss. She said, oh, around 5 or 6, maybe. So now I find out about the grandma and the dog and the divorce, and I say, no wonder. Okay, that makes sense on the timeline, makes sense. And then we get to why at 7 years old is when the vomiting starts. And she said, we don't know what did it. So, I'm zigzagging, getting whiplash, asking questions. She's telling me the story. The little girl is there. She's, chiming in a little bit. And I'm asking questions. We went over time, but get to the very, very, very end. And I said, is there anything else that's going to jump out of the bushes and bite me? In other words, is there that will help me be able to provide more direction? And she goes, maybe. She said, well, this probably doesn't have anything to do with anything, but she did have a root canal. What? How old was she when she had that root canal? 7. 2nd grade. Can you tell me what tooth that's root canal? She didn't answer because she was late getting her paperwork to me. So she skipped over that part of the intake form. And I I said, could you tell me what tooth? And while she's looking and she's going through her phone or whatever she's looking, I'm pulling up a tooth chart because I'm on a Zoom call. I'm pulling up a tooth chart, the tooth meridian chart. You know where this is going, don't you? Yep. You 100% know exactly where this is going. I can tell you that right now. The absolute tooth that was associated was tooth number 14, which has to do with stomach and spleen. And when I let the mom see it, she was shocked. She was like, my gosh. And then we were out of time. So I said, okay, I'm going to follow up with a long, detailed email. I'm going to give you my thoughts. And then I said, I need dental records. I need medical records. They scanned her gallbladder. They did all things. I said, you have to give me everything. I had nothing. But there we are with the root canal at the very end. I literally my teeth about fell out of my head. So, you have to just let them tell the story. And had I not asked the question, I wouldn't have gotten that information. All right. Principle number 3 is don't let what the patient say drive your thinking or your theory. You have to be able to think independent of what the patient says, because if you don't, then the patient is going to be the one that's going to say, well, I think it's this and I think we need to do this. Never let that. Your job is to listen respectfully and then follow the evidence. You have to look at the test results. You have to look at what they're talking about, and then you can make a good recommendation. So it doesn't mean that you're dismissing what they believe at all. You're just taking it into consideration, but then as a professional, you have to provide the right information based on your clinical experience and guidance, knowledge. So number 4 is don't treat the symptom instead of the system. Sometimes we get so myopic in like, oh, you're having hot flashes, let's give you something for hot flashes, when really it's the endocrine system that's out of whack, including the adrenal glands. That's an obvious one with menopause, right? So what we want to do is make sure that we're looking at the system, not just the symptom. I do this all the time. It's like with the restless leg. I think, oh, it's her leg. So it must be a mineral deficiency, it must be muscles, it must be, what could it be? Maybe nerves. Okay. And I'm treating the nerve, but I'm not looking at the system. What system is being impacted? Why does she have this? When did it start? What systems are dysregulated? So look at the system, not the symptom, I should say, the system and the symptom. Number 5, sometimes the best thing you can do is to just take a step back and not do anything at all. And encouraging the patient to look subjectively at their symptoms, but also to give you feedback about, hey, what's working and not working. But also don't ask them so often to evaluate their symptoms. It's kind of like the young man from last week's episode where he, I call it navel gazing. When your head is so far in your navel, you're like in your navel, every symptom, everything. My big toe hurts. My grain, this little piece of hair hurts. The little, back of my earlobe hurt. You get so navel gazy, so you can't see anything else. But then that can increase anxiety. Checking a stool or doing all of those things. Sometimes that makes it worse. So sometimes we just have to let it happen and help them be able to feel comfortable just taking their foot off of the subjective objectivity. I guess I'll say, right? It's subjective, it's their experience, but we're asking them to look at it objectively and they can't. So create safety, create consistency, let their body feel safe with what you're doing, and then you can come in with some support. That doesn't mean that that's with every single case, but it's with a lot of them. And then lastly, have humility. It's okay if you don't know, and it's okay if you say, I don't know. I'm going to go find out, and if I can't find an answer that suits me, I'm going to find someone who can help us. And either you refer them out. Like recently, I've referred several people out to a practitioner who does a certain type of tapping. We all know what that is, because I knew that was not in my scope, my wheel. I'm not good at it. I know how to do it, but this individual is really good at it. And so I said, okay, I've got a couple people that I want to send. So I checked with the practitioner and said, can you take these couple of people? Yes, sure, I can. No problem. And now they're getting better. And I'm thrilled because it's all about working together. So humility is me saying, I'm not real good at this, but I know someone who is, or I'll find someone who is. It's okay. We don't have to know everything. If you come off that you know everything and there isn't anything that's you don't know, that doesn't breed trust. People trust you more when you have humility and you say, I don't really know. It's not a weakness. It's just your job. So this clinical thinking series I found it very interesting. I don't often do a lot of clinic. I do some because I really love the business aspect. And I think that the two go together very well, right? We think about like, oh, well, I just need to know more clinically. So here you go. Here's some of my successes and my failures. But when we know more clinically, if you have a business that's like a broken down car with only 3 wheels and no windshield and your lights don't work and you're trying to run a business and it's all rickety and ripshod and not doing well, you're not going to be as successful. In fact, I would argue that those businesses typically are more like you have a business that looks like your hobby. You're doing a hobby and you're saying it's a business, but you really aren't treating it like a business. And that's the thing. We have to get serious about business, but we also have to sharpen clinical skills. So if you are one of those people that you think, I need to know everything that I can clinically, I've got you. You go to Clinical Academy. It's a monthly clinical membership. Think of it like Netflix. Like you don't have to watch every movie on Netflix, but when you have something that you want to know more about, you can go log in and watch that movie. Same with Clinical Academy. You can go in and get the answers that you need. It gives you beyond the what, it gives you the how. So we go to like FMU or you graduate from school or you have some advanced clinical training. That's all the what. Clinical Academy gives you the how. It helps you implement. It gives you the strategies. It gives you the supplements. You get the protocols. You get testing results, what tests to order. It gives you the practical how. And yes, you can get some of that in FMU. And yes, you can get it in IFM. You can get it in all the places. But this is the down and dirty, like boots on the ground in the practice in front of the patient. How are you going to get them better? All you have to do is go to rhondanelson.com// clinical academy. Go check it out, join. If it's not your flavor, fine, quit. But if you love it and you want to stay, I would love to have you. And if you are one of those people that you say, I really need help with my rickety business that's ricketying along, if that's a word, and you know that the business side of things is not working well, that is when you need to be in Clinical Business Academy. It is where practitioners are literally transforming their practice. They're making more money, they're serving more people, and they're doing it so easily. It's just so easy because when you put the right systems in place and the processes in place and you understand how to structure a practice, a cash-based wellness practice, that's when the revenue starts to come. You're able to serve more people and you can do it with so much less stress and such a grateful heart because you're doing what you love, but you're doing it with ease. To learn more, you can go to rhondanelson.com/CBA. So if you want the resource, I've talked about it on the other 5 podcasts. Again, Rhonda Nelson /6 principles. The number 6 principles. That'll give you a recap of what I have talked about today to some degree and a little bit more info. But thank you for joining me on this little 6-week journey. I'll be back next week with some more highly compelling podcast material for you. See you then.